Welcome to our comprehensive guide on colonoscopy, a vital procedure in the realm of digestive health and cancer prevention. If you've ever wondered what a colonoscopy entails, its significance, and why it's recommended, you're in the right place. Colonoscopy is more than just a medical procedure. It's a powerful tool for early detection, prevention, and treatment of various gastrointestinal conditions, particularly colorectal cancer. In this guide, we'll take you through the ins and outs of colonoscopy, from its purpose and preparation to the procedure itself, and what to expect afterward. Whether you're scheduled for your first colonoscopy, considering the procedure, or simply seeking to expand your knowledge about gastrointestinal health, join us on this journey to uncover the importance of colonoscopy and how it plays a crucial role in safeguarding your well-being. Colon cancer screening. Colon cancer is one of the most common cancers worldwide. But here's the good news. When detected early, it's highly treatable. That's where colonoscopy comes in. Colon cancer screening is a proactive approach to check for early signs of colon cancer or precancerous growths called polyps. There are several types of colon cancer screening tests available, including colonoscopy, a comprehensive exam using a flexible tube to check the entire colon; fecal occult blood test, a stool sample test to detect blood not visible to the naked eye; flexible sigmoidoscopy, similar to a colonoscopy but focuses on the lower part of the colon; key colonography, a virtual colonoscopy using CT scans. Who should get screened? Screening guidelines vary, but generally, individuals at average risk should begin regular screening at age 45 to 50. However, if you have a family history or other risk factors, your doctor may recommend starting earlier. Regular colon cancer screening can catch issues before they become cancerous. It's vital to stick to a screening schedule recommended by your healthcare provider. Before your screening, your healthcare provider will give you specific instructions. This might include dietary restrictions, a liquid diet or a laxative to clear your colon for the test. It's essential to follow these instructions carefully. Screening process. During the screening, your comfort is a priority. You may receive sedation for procedures like colonoscopy, ensuring minimal discomfort. After the screening, your healthcare provider will discuss the results with you. If any abnormalities are found, don't panic. It doesn't necessarily mean cancer. Further tests and treatments will be recommended as needed. Colonoscopy is considered safe and effective for diagnosing and sometimes treating various gastrointestinal conditions. There can be some side effects and risks associated with the procedure. Here are some potential side effects and considerations. Bleeding. Minor bleeding can occur at the site where tissue samples, biopsies, are taken or if polyps are removed during the procedure. This bleeding is usually minimal and stops on its own, or can be managed during the procedure. Pain or discomfort. Some individuals may experience mild abdominal discomfort or cramping during or after the procedure. This discomfort typically resolves within a short time. Perforation. Although rare, there is a risk of the colon being punctured or torn during a colonoscopy. This can lead to infection or other complications and may require surgical intervention. Reaction to medications or sedation. Colonoscopy often involves the use of sedative medications to make the patient more comfortable. There can be rare allergic reactions or side effects to these medications. Infection. While strict infection control measures are in place during colonoscopy, there is a small risk of infection, particularly if there's any contamination of equipment or improper sterilization procedures. Incomplete procedure. In some cases, the colonoscopy may not be completed as intended due to various factors, such as the inability to pass the scope through certain portions of the colon. Dehydration. Fasting before the procedure and the use of laxatives can lead to dehydration. It's essential to follow the preparation instructions provided by your healthcare provider. Cardiovascular or respiratory complications. For individuals with underlying heart or lung conditions, sedation during the procedure may pose a higher risk. It's important to note that the benefits of colonoscopy in terms of early detection and prevention of colorectal cancer often outweigh the potential risks and side effects. Your healthcare provider will assess your individual risk factors and discuss these with you before the procedure. If you experience severe pain, bleeding, or signs of infection after a colonoscopy, it's crucial to seek immediate medical attention. What to ask the doctor before getting a colonoscopy? Before undergoing a colonoscopy, it's essential to have a thorough discussion with your doctor to ensure you understand the procedure, its purpose, and any potential risks or considerations specific to your health. Here are some important questions to ask your doctor before getting a colonoscopy. Why is a colonoscopy recommended for me? Understand the specific reasons for the procedure and what your doctor is looking for, such as screening for colorectal cancer, investigating gastrointestinal symptoms, or monitoring a known condition. How should I prepare for the colonoscopy? Ask for detailed instructions on the bowel preparation process, including dietary restrictions, laxatives, and timing. What are the potential risks and complications associated with the procedure? Discuss the possible side effects, such as bleeding, perforation, or adverse reactions to sedation, and how these risks apply to your situation. Are there any alternatives to a colonoscopy? In some cases, alternative screening methods may be available, such as virtual colonoscopy or stool-based tests. Ask about the pros and cons of each option. What medications should I continue or discontinue before the procedure? Inform your doctor about all medications, supplements, and allergies to ensure the safest and most effective preparation and procedure. Do I need to make any adjustments for any underlying health conditions? If you have existing medical conditions like diabetes, heart disease, or kidney problems, discuss how these conditions may impact your colonoscopy and any necessary adjustments. Will I receive sedation during the procedure? Understand the type of sedation or anesthesia used, the associated risks, and how it may affect your recovery. How long will the procedure take and what can I expect during it? Get an idea of the duration of the colonoscopy and what sensations or discomfort you might experience during the procedure. What will happen if the colonoscopy reveals abnormalities or polyps? Inquire about when and how you will receive the results, as well as the follow-up plan based on those results. Is there anything I should avoid or be aware of after the colonoscopy? Understand post-procedure recommendations, including dietary restrictions, activity levels, and potential side effects like gas or bloating. What is the cost of the colonoscopy, and does my insurance cover it? Clarify the financial aspects, including insurance coverage, copays, and any out-of-pocket expenses. Can I have a family member or friend accompany me to the procedure? What to do before a colonoscopy? Preparing for a colonoscopy is essential to ensure that the procedure is successful and that your colon is adequately cleaned for a thorough examination. Here are the general steps to follow before a colonoscopy. Your doctor will provide you with detailed instructions for bowel preparation. This often includes dietary restrictions and a prescription or over-the-counter laxative to help cleanse your colon. Follow these instructions carefully. Dietary changes. Typically, you'll be asked to follow a clear liquid diet for a day or more before the procedure. Clear liquids may include water, clear broths, gelatin, strained fruit juices without pulp, and popsicles. Avoid red or purple-colored liquids as they can resemble blood during the procedure. Stay well hydrated by drinking plenty of clear fluids during your fasting period. Dehydration can make the preparation process more challenging. Follow the prescribed bowel preparation regimen as directed by your doctor. This usually involves taking a laxative solution or tablets. Be prepared for multiple bowel movements, which help clean your colon. Plan for time off. Consider taking a day off work or other responsibilities on the day before and the day of the colonoscopy. The preparation process and the procedure itself may require rest and relaxation. Arrange transportation. You will likely be sedated during the procedure, so arrange for someone to drive you home afterward. You should not drive or operate heavy machinery for at least 24 hours following the colonoscopy. Follow the fasting instructions provided by your healthcare provider. Typically, you'll need to stop eating solid foods at least 24 hours before the procedure. Clear fluids are allowed up to a few hours before the colonoscopy. Clear the schedule. Clear your schedule for the day of the colonoscopy. The procedure itself usually takes around 30 minutes to an hour, but you will need time for preparation and recovery. Wear comfortable clothing. Choose loose, fitting, and comfortable clothing for the day of the procedure. You may be asked to change into a hospital gown. Tips to remove waste from colon. Dietary fiber. Include high-fiber foods in your diet, such as whole grains, fruits, vegetables, legumes, and nuts. Fiber adds bulk to the stool, making it easier to pass. Hydration. Drink plenty of water throughout the day to keep your stool soft and prevent constipation. Aim for at least 8 cups, 64 ounces, of water daily. Consume foods rich in probiotics like yogurt, kefir, and sauerkraut. Probiotics promote a healthy gut microbiome, which can aid digestion. Exercise. Engage in regular physical activity. Exercise can stimulate bowel movements and improve overall digestive health. Limit processed foods. Reduce your intake of processed and sugary foods, as they can slow down digestion and lead to constipation. Avoid overuse of laxatives. Don't rely on laxatives for regular bowel movements. Overuse can lead to dependency and disrupt natural bowel function. Prune juice. Prune juice is a natural remedy for constipation due to its high fiber and sorbitol content. A small glass can be effective. Herbal teas. Certain herbal teas, like ginger or peppermint, can have digestive benefits and promote regular bowel movements. Limit red meat. Reduce your consumption of red meat, which may be linked to an increased risk of colorectal cancer. Opt for leaner protein sources. Whole grains. Choose whole grains over refined grains to increase fiber intake. Examples include brown rice, quinoa, and whole wheat bread. Adequate sleep. Ensure you get enough quality sleep, as sleep deprivation can affect digestion and bowel regularity. Smoking and excessive alcohol consumption can negatively affect digestive health. Quit smoking and drink alcohol in moderation. Thank you for joining us in this important discussion about colonoscopy and colon health. We hope that you've gained valuable insights into the significance of this procedure and the steps to prepare for it. Remember, your health is your most precious asset, and taking proactive steps like regular screenings can make a significant difference in early detection and prevention. If you or a loved one is due for a colonoscopy or have any concerns about digestive health, don't hesitate to reach out to your healthcare provider. We encourage you to share this information with friends and family to spread awareness about the importance of colonoscopy in safeguarding your well-being. Stay informed, stay proactive, and take control of your health. Thank you for watching, and we wish you good health and peace of mind on your healthcare journey.